Thank you so much. Now we're going to bring our second speaker to the stage, Dr. Barbara Bartlik. Barbara is an expert in integrative psychiatry, emphasizing evidence-based holistic approaches to mental health and sexual wellness. She is triple board certified in psychiatry, integrative medicine, and sexology. She is a sought-after speaker, conference leader, talk show guest, author, and honored by New York Magazine as a best doctor in psychiatry.
So we have sex after lunch just to make sure you stay awake. So, how does psychiatry, sexual health, and functional medicine come together in how you practice? Can you share some of your genius?
Typically when a person sees a psychiatrist, they either get psychotherapy or medication. And we now know that the medications have some very serious side effects. So I take a functional medicine approach, and I give nutritional supplements, recommend changes of diet to less inflammatory foods, less processed foods, and health and exercise and sleep and all of those good things that go along with integrative medicine. And when it comes to sex, what's good for your mind is good for your sex life. And there are many natural remedies to treat sexual problems. So I think that those three board certifications go very well together.
Yes, they do. Yeah.
I think I'd like to begin by showing everybody a video. Is Victoria there to put the video on?
Yes, she is.
Okay, very good. Okay, so I'll tell you about this. This is Katherine Heigl, who was on the show Grey's Anatomy and played a doctor. And this is her speaking with a friend about a problem that is very common in women. And in fact, I bet half of you in the room have this problem. And you'll soon see. So I'm going to actually, till the video is ready, I'm just going to tell you what it's about. It's about bladder leaks or urinary incontinence. 75% of women over 65 have this problem. And for women under 65 and over 50, 43% have this problem.
Oh,
I peed. Happens to the best of us.
that's so embarrassing.
You're gonna deny your mother a moment of mirth just because she got the giggle dribble? After kids, the pelvic floor can weaken, and then perimenopause reduces estrogen. Here, I have a poise.
Perfect for my leaking bladder. By the way, how did you know all that stuff?
Well, I used to be a doctor.
No, you didn't.
So this is poise pads, very commonly used now amongst women. And you notice they made reference to her being a mother. Well, 80% of the women with bladder control problems have had children. So it does seem to be related to childbirth in some way. Now, I also want to mention something that my favorite comedian, Wanda Sykes, said about bladder leaks, okay? She said that, as she gets older, her body is changing, and she noticed that when she says that she has to pee, she means she has to pee right now. And then also she said in the old days when she was young, she used to carry around a pair of panties in her purse in case she got lucky. Now she carries around a pair of panties in case she sneezes, okay? And also she said when she had the urge to pee while she was watching a movie, she used to be able to wait an hour or so before she got up. Now she has to go immediately or there's going to be trouble. So, so I do think that we need a lot of solutions for this problem. We only have surgeries and medications. Medications have awful side effects, dry mouth, constipation. The surgeries can be devastating. We need more solutions for this problem. So it turns out that the old-fashioned Kegel exercises are very good for bladder leaks. They're also very good for sexual problems, and that's how I got into it. Because as a sex therapist, I was always recommending Kegel exercises to improve arousal, orgasm pleasure, and also they, believe it or not, reduce sexual pain. And they help men last longer and have better erections, and also men sometimes have pain, and they help men there too. So when it comes to the bladder floor, it supports all of your pelvic organs like a sling. Your bladder, your uterus, and your rectum are all supported by the pelvic floor. And if it's weak, the organs can prolapse and come out, and you need surgery. And it's very devastating. So, yes, so we need to do Kegels, but women have trouble doing Kegels. I've talked to women about this so many times. They can't get it. They can't keep it up, even though they say only 10 minutes a day. They can't keep up with the schedule. They're busy. They have so many things they're doing. They don't feel the difference, so they don't see that it's working, so they give up. And they're not working on, basically, I think women should start Kegels when they're teenagers and continue them through life, like other forms of exercise. And in France, they give women 20 pelvic floor physical therapy sessions after childbirth for free from the government, because they want to preserve the health of the pelvic floor in women there and prevent these problems. In the United States, we get one postpartum visit 6 weeks after birth, and that's it. And rarely is pelvic floor physical therapy recommended. And they have some devices, electrical devices, that can be very helpful in helping you do Kegels. One is like a TENS unit, transcutaneous electrical nerve stimulation, that stimulates the muscles to contract. And the contractions are stronger than you can do on your own, and you don't have to think about it. You could be reading a book and have contractions at home. Of course, this machine costs about $1,500. You can get it at your physical therapist, but then you have to go in for sessions. And the other machine is a biofeedback machine, which monitors graphically how well you're doing your contractions. And most women don't do them right. They don't breathe appropriately. The right way to do it is, on exertion, you should be exhaling. And when you release, you should be inhaling. And most women do the opposite. So you need training to do Kegels properly, and most women don't get it. And then there is another device that is really good called pulse electromagnetic field therapy, and that is it produces a magnetic field that, when you put it on the target area, it could be your pelvis, it could be your knee, your neck, whatever. It opens up the blood vessels, and you get improved circulation, healing, oxygenation, and it's wonderful. And it has been shown to help urinary problems and sexual problems. So that is another one, but that is an expense. None of it's covered by insurance. And then there is something special called the Emsella chair, which is a high-intensity PEMF machine. You sit on it 3 days a week for 2 weeks, and it improves bladder function and sexual function. So I highly recommend it. And then I also want to refer you to my website if you want to get more information, drbarbara.md.com, and also pelvicfloorrescue.org. And the other problem I want to mention is testosterone. Testosterone has declined in men dramatically in the last 40 years. Men today have 20% lower testosterone than they had 20 years ago. And so that is a real problem, because testosterone is so important for vitality, psychiatric, sexuality, everything. So why is that happening? It's probably our lifestyle, being sedentary, having metabolic syndrome, getting toxins, getting hormones in the food. and maybe even the electromagnetic frequency that's all around us. That can even affect testosterone. Men's sexuality, they usually drive the sex in the relationship. I know women have drive too, and women initiate, but the fact is that most of the times in a relationship, the man initiates usually. And if he's not initiating because his testosterone is low and his libido is low, they're not having sex as often, and that is very unifying, very wonderful, and for enhancing the relationship. So the couples are missing out, and it's happening with married couples and single people who are in relationships. And so I think we need to do things to support testosterone. You can raise your testosterone by exercising, by taking nutritional supplements.
Can you say more about the nutritional supplements?
Yes.
Because I know that's a
That's your
question on
first
here, and I
question?
want to know.
Okay, sure.
What are some of those? And
Yes.
also, while you're on the testosterone topic, I've also heard of testosterone for women. Is
Yes.
that something that we need to be or
We do.
want to be
When
looking out
women-
for?
When women have more testosterone, they feel more alive, more vibrant, they have better musculature. In fact, women who are low in testosterone are more likely to be depressed. So testosterone supplementation is a good thing. But with women, you give it in a cream form. It can go on the skin, on the body, or you can put it directly on the clitoris and the labia, and it actually makes the clitoris a little bit larger and more accessible, because a lot of times women go through menopause, their clitoris disappears. They can't feel it anymore. They're not as sensitive. So I think it's a good thing. And with men, they can take testosterone as well. You can't do it when you're a younger man. It might make you sterile. If you want to have children, you shouldn't do it. But older men can, if they don't have certain cardiovascular problems that might make them prone to a heart attack. You have to monitor them, make sure their red blood cell counts don't go up too high. That could be dangerous. But yes, you can take it. And then you can take a number of nutritional supplements that improve testosterone. Tribulus, resveratrol, chrysin, there are a number of them. And then there are a lot of vitamins, minerals that help sexual functioning. B12, B6, folate, which is B9, vitamin C, magnesium, zinc, boron. These are just a few. So, a good multivitamin that has methylating vitamins would be a good thing for your sex life. And then there are a bunch of herbs that are wonderful. Ashwagandha will increase testosterone, and Damiana is very good for sex, and Tribulus, and rhodiola, a number of them. So these are things you can do.
That's great. We have time for one question in the audience. Anybody? Yes. So the question is there an integrative center that people can get a more holistic kind of functional medicine treatment?
There are many doctors around town who do integrative medicine. A lot of times they are fee-for-service and they don't participate in insurance. But people can do so much to help themselves, to get themselves educated by searching the web and finding out what to do. It's a tragedy in psychiatry that the medications that we give our patients for mental health problems make them obese. It's really a tragedy, and there has to be another way. But the person has to be willing to drastically change their lifestyle. I mean, strict Mediterranean diet, and anti-inflammatory diet, and most people are not willing to give up those things that they need to do to change their life. They would rather live with their psychiatric symptoms and take medication.
Which is why we need people like you to keep us accountable so that we can stay healthy, have good relationships, lots of great sex, and live longer. So thank you so much, Barbara, for being here today.